Hello everyone. Today we are gonna discuss about the pharmacology autocoids. We all 1 minute. I'm sorry. Yeah. Let's discuss about autocoids. What are autocoids? What is its definition? What's its classification? And everything we wanna discuss here. Much detail is not needed for FMG purpose because we know that they hardly ask means 6 or 7 questions from pharma. So let's begin. Now autocoids, these are nothing but a substance. Okay, I mean there is like one cell, so different cells in our body are there, and these cells, what they do, that these cells secrete some substances. Okay, and these substances are basically autocoids. Why? Because these substance, what it will do, they will go at certain site and there they will cause irritation, and because of that that area will become inflamed. So that's why they are known as autocoids. So in simple definition, these are substance which are produced by various type of cells that are means that shows their action locally. Now the autocoids, if we see, yeah. So the autocoids are, I have told the definition, they are further categorized into amines, lipids, and the peptides. In the amines there is histamine and there is serotonin, whereas in the lipids there are prostaglandin and there is leukotrienes. Okay, there is leukotrienes. Okay, then there is peptide contain the angiotensin as well as the bradykinin. Now let's talk about the histamine. This video is mainly for antihistamine. Now the histamines, as we know, these are like a reason, these are the reason for causing the allergy, any types of allergy and inflammation and bronchoconstriction plus wakefulness in the human body. Like for example, there is like after taking the antihistamines, the patient is how to say, feeling wakefulness. Okay, and like suppose a patient is coming with allergy, so much itching, suppose a patient got sting bite from the bee, or it might be that because of seasonal change there is like some pollen grains. Okay, so those are the reason for allergy. So what is happening, that these histamines, they are releasing inside the body. Okay, and these are leading to inflammation as well as the bronchoconstriction. So what is bronchoconstriction? We know that there is lungs. Okay, like for example, this is our lungs. Okay, and in the lungs there is like these are the bronchus actually, and this is trachea which will go further and open into the like open into the mouth. Okay, I mean this is the mouth. Okay, and from here this trachea is starting. Okay, like this. Okay, and there are larynx and pharynx all. Okay, so yeah, let's begin. So that's how. Now basically these histamines, what it will do, they will cross the blood brain barrier, but not all histamines cross the blood brain barrier. Why so? Because they have different compounds. Okay, for example, the first generation H1 antagonist and the second generation H1 antagonist, we have to block this histamine, right, to like reverse the situation of the patient. So for first generation antihistamines, H1 antagonist, they will cross the blood brain barrier. It is a barrier between our brain and the blood vessels, so it is a barrier between them. Okay, so first generation can cross that and can cause in the patient sedation and sleepiness and all. Okay, now there are very highly sedative drugs, like for example diphenhydramine, then hydroxyzine, then doxylamine. Okay, then the promethazine. These are the first generation H1 antagonist. Okay, so basically this doxylamine we have discussed previously that it's used in case of morning sickness. Okay, like in a pregnant female, what happens is like in morning, in especially in first trimester, she feels vomiting type. Okay, she feels nausea. So in such case we can give this H1 antagonist first generation, that is doxylamine. It is a drug of choice for morning sickness. Okay, another one is promethazine. This promethazine is used for motion sickness. Whenever a patient is traveling and while traveling that patient is feeling nausea, vomiting, we are going to use it. Okay, it is used in that case. Then other drugs are like moderate sedations, that for example like this phenyramine and like meclizine. Okay, so this one phenyramine, meclizine. Then mild sedative drugs like chloramphenyramine, then cyclizine. So these H1 antagonist first generation, these are what, these are anticholinergic, they have anticholinergic effect. That means they are like showing here anti-emetic effect, that means against vomiting. We have just discussed this one. Okay, and this one also. Now let's talk about this one, that is the second generation H1 antagonist. So in the second generation antagonist, what exactly there is that they do not able to cross, they're not able to cross the blood brain barrier, because they have different compound, they have different chemistry. So hence they will not lead to sedation, they will not lead to any like sleepiness symptom or anything. Why? Because they're not able to cross the brain, as simple as that. So they have certain there are certain examples like citrizine, like levocitrizine, like lotadine. Basically lotadine is long acting, etc. Mainly these are important, so we're gonna discuss only that. Now basically these antihistamines, they are used in case of urticaria. So what exactly is urticaria, I will gonna show you its image at the end of the video. Okay, and they can also lead to like pruritus. Pruritus means itching, like patient is feeling itching. When there is any allergy, the patient feel itching, and there comes the rash and all. Okay, so this all basically a form of rash is urticaria, and itching means pruritus. Okay, and any insect bite. Okay, due to H1 block, again H1 block is there. Then in common cold also histamine plays important, also for that also we can use these medicines for like treating them. Then also for the prophylaxis of motion sickness. Okay, now basically in the first generation antihistamines, or we can say that H1 antagonist, these diphenhydramine and the promethazines are preferred. Okay, then this one na diphenhydramine, yeah. So 1 minute. Yeah, diphenhydramine and another one is this promethazine are preferred. Okay, another one is this like Meniere's disease. See, Meniere's disease is a vertigo. What exactly is Meniere's disease? Suppose for example, see, Meniere's disease is a disease of inner ear. This is our external ear. Okay, and then this is the middle portion of ear, and then comes the our inner portion of ear. Okay, so basically what is happening, the Meniere's disease is the inner portion disease, inner ear disease. Basically we can say that, which is leading to vertigo. Vertigo in Hindi it means chakkarana. Okay, that means dizziness, feeling dizziness. Okay, and like this. Okay, so basically in Meniere's disease also we can give the histamines analog, and also we can give this cynarizine, and we can give first generation antihistamines. These are used basically. Okay, then lastly there is like this one, this terfenadine and this estemizole. These are what, these are potassium channel blocker. That means there is a cell in our body. Okay, this is a cell suppose. Okay, and we know that cell have so many channels, so that other substance can pass through those channels and can come out from those channel, right? So one channel name is potassium channel. Okay, so this potassium channel, what exactly is happening over here, that this potassium channel, these drugs, they will block this potassium channel. Okay, so if they block this potassium channel, what will happen, that the potassium can't go here and there. So what will happen, there will be increased risk of QT prolongation. Okay, there will be increased risk of QT prolongation, there will be increased risk of, we can say, torses de pointes. Okay, so we know that this is P, then there is Q, then there is R, then there is what, S, and there is T. This is P, this is Q, this is R, this is S, and this is finally T. Okay, so this Q and this T, so this gap prolongation. Okay, this is the torsus de pointes. Okay, this comes under torsus de pointes. Okay, so this is a basically side effect of this like terfenadine and estemizole. Okay, so another, this is the end of the antihistamines, but let's see few images. This one I have talked about, this is diphenhydramines, come under this name. Okay, and see it's written also, if there is like skin itch, there is hives, there is sneezing, there is like itchy throat, there is itchy runny nose, there is itchy watery eyes, etc., and may cause drowsiness. As I have already told you, it can cause sedation because it can cross the blood brain barrier, and it is what, it is our what, it is first generation antagonist, H1 antagonist, right? Let's again see if you don't remember it. See, I have told you it is first generation diphenhydramine, antihistamine, first generations come under that. Okay, now let's talk about this one. Not let's talk about, I'm sorry. Let's see further image. Now this one I have talked about. Okay, this is basically a image of urticaria. Okay, these patches, these inflammatory patches. Okay, we have seen, like we are seeing here, reddish inflammatory patches, and patient is coming with so much itching. Okay, so these are basically known as what, these large, okay, so these are known as what, urticaria. Okay, I have told you already. Okay, see, if you just forget already, I have told you here. Okay, urticaria, we can use this antihistamine in case of urticaria also. Okay, then last image is this one over here. Yeah, this one. So this is basically a like bite of a honeybee. Okay, sting bite. Okay, so basically here we are seeing, see, and the patient is again, patient after some time will feel itching, and there will be like there will be allergic. Okay, there will be allergic reaction, and then certain histamines also released, and then what will happen, certain histamine release, and then certain symptoms will appear, so we will give again antihistamines. So that's all for today, and this is antihistamines. Thank you so much.